Welcome back. You're still watching It's a Beautiful Day. This is Weather HQ. Large areas in Quezon City and Rizal have recently been shrouded in haze, primarily due to multiple fire incidents, prompting heightened concern over the deteriorating air quality in these locations. The Department of Health has released a public advisory urging everyone to regularly check the air quality index, remain indoors as much as possible, and wear face masks to minimize exposure to harmful particulates, especially for the individuals suffering from respiratory conditions. Now, to help us understand the health risks, safety guidelines, and the government's ongoing response, we have with us on the line Dr. Albert Domingo, Assistant Secretary and Spokesperson for the Department of Health. Magandang umaga, Asik Domingo. Thank you so much for joining us on It's a Beautiful Day.
Yes, good morning. Magandang umaga, Paolo, and to Anne and Monique also. Good morning, everyone.
Thank you so much. Asik, let's start off first with the definition kung ano nga ba ang haze. Because we are seeing that more in the news right now, and of course, there are health hazards associated with it.
Right. Haze is interchangeably used informally with smog sometimes, no? Tapos pag tinatagalog natin, that's even tougher to translate. The catch-all term is usok.
Yeah.
Although in English, usok is smoke. Now, what's important across all the terms, in particular sa haze, is yung particulate matter. That's what we released yesterday. We explained that particulate matter, or PM as it's called, has two sizes of concern. Yung 10 micrometers and yung 2.5 micrometers. Whatever this is, whether you call it haze, smog, or usok, it's important that we avoid suspended particulate matter in the air because it can, one, irritate our nose, our sinuses, and our throat for the PM10. And two, for the PM2.5, it's even worse, Paolo. Pwede siyang pumasok deep into the lungs, and in some cases, it can cross over into the bloodstream and can even lead to cardiovascular diseases over time.
Mm-hmm. Doc, the DOH has advised the public to monitor the air quality index. Again, for those who need to access it or for those who want to access it, where can they see the real-time air quality data?
So there are two ways to access it. Number one would be officially, the Department of Environment and Natural Resources, particularly the Environment Management Bureau, has a website. So the main website is denr.gov.ph. Then please search for EMB or the Environment Management Bureau. But another way, a bit more convenient, is to download your favorite weather app. Whatever the weather app is, as long as it's getting data on the Philippines, chances are there is a section that says air quality index. And then there will be the green, I think that's healthy or fair. And then if it gets worse, it says unhealthy, severely unhealthy. The worst would be emergency. So importante yun, Paolo, kasi it's like the heat index, diba? Nowadays, it's summer, so we check on the heat index. We will know what to wear, what time to avoid the sun. With the air quality index, we know what areas to avoid if possible, or if we can't avoid the area, if we should bring a mask or not.
Mm-hmm. Doc, when you mentioned PM10, PM2.5, the particulates, and of course yung health effects niya, or at least the adverse health effects, how much more dangers are they for yung mga vulnerable groups po natin, especially the senior citizens and of course children?
Right. Your sensitive populations, as we call them, or vulnerable groups, would include, you're correct, the senior citizens, the children. But in this particular case, Paolo, because we're talking of respiratory illnesses, those with bronchial asthma, yung mga may hika, those with chronic obstructive pulmonary disease, emphysema, usually sa mga mas matanda yung COPD tsaka emphysema, ito yung mga delikado because to the general public without these diseases, for example, if the air quality index says poor, baka kaya pang itolerate ng general public. Pero dun sa mga sensitive, pag poor, nagsisimula na yung mga asthma attacks, nagsisimula na. And how does an asthma attack feel like? I say this from experience because I'm also an asthmatic. You actually feel like you're drowning. Parang hindi ka makahinga kasi ang higpit ng baga mo. So yun yung pwede mangyari if you are part of the sensitive population in an area where the air quality index is poor or worse.
Doc, one of the advisories we had was the use of face masks yet again. Of course, schools are there's still some schools there that are still having classes. What advice is normally given out to those going to schools at the moment, and of course, even those going to work in general?
So the challenge with face masks is, since you mentioned the school, age is also a factor in the proper use of face masks. Remember, during the pandemic, it was difficult to make a judgment call whether to require 5 years old and below to wear masks because children don't, particularly 5 and below, they don't clearly understand what the use of a face mask is, or they can't tolerate having a face mask, no matter how small or how fit it is on their face. So maybe let's talk about the older children. The school, if air conditioned, will probably have a better chance because your air cons have filters. But if you don't have air cons, you can still ask kids 5 and up to wear face masks. But in this case, dapat N95. And I'll go now to the office age, no? Ganun rin, if you're in the office, chances are the office is air conditioned, malinis naman yung hangin. Pero kung hindi siya and you're in an area na talagang bad yung air quality index, kailangan naka N95 face mask kasi yung particulate matter yung iniiwasan natin.
ASEC, of course, all of these advisories did come because of the sudden haze that did happen in Quezon City and Rizal in particular. Is it advisable to actually have N95 masks still within reach, especially for those commuting, just in case, considering the air quality being experienced currently at the moment?
So some practical advice, if you belong to the sensitive population, meaning you do have the diseases mentioned, asthma, COPD, emphysema, it may be good to have an N95 mask with you if you are going to an area where the air quality index is poor or worse. Wala kang magagawa, you have to go there, so bring an N95 mask with you. Pag tayo naman, general public, wala naman tayo ng ganung conditions or hindi naman tayo vulnerable population, kahit yung mga cloth masks, they still help, and even yung mga medical masks are also allowable. So the N95, don't go out there, no? Everyone who's listening and watching, this is not like a situation, let's go to the nearest drugstore and buy an N95. No. It's only for sensitive population. Kasi ina-anticipate ko na, Paolo, baka mamaya mag-panic buying. No, hindi po. Yung sensitive populations lang yung magbe-benefit from the N95.
Doc, any last piece of advice before we let you go?
At the end of the day, Paolo, this is all a matter of even the upstream. Meaning when I say upstream, where does the particulate matter come from? So we think of the smoke emissions from cars, yung mga smoke belcher. We think about the industries, the factories. We think about even yung mga nagsusunog pa. Narinig ko kanina off-air, sabi ni Monique, what is siga? Diba? Siga is burning.
Oh my God, I got exposed, Doc!
O, diba? Well, bawal nang magsiga actually kasi merong nga Clean Air Act. So hindi na tayo dapat nagaganon. So again, it's a concerted effort. Hindi tayo dapat nag-react lang kapag nagkakaroon ng haze kasi medyo advanced na yung haze eh. Let's prevent air pollution so that we don't have to talk about wearing masks or panicking because of these situations.
Thank you so much for that, ASEC. Nawala yung pagkasiga ni Mo dahil dyan. Thank you so much, ASEC Domingo, for joining us on the show. And hopefully we can have you in person this morning next time. Thank you so much.
I look forward, Paolo, Ann, and Monique. Good morning.